So I've decided, since I miss my patients and I miss dental so much, I'm going to decide to tell my very funny dental stories. Yes, because I have so many. So one day we're working and the boss decides he's going to start closing down the office early. He says, hey, girls, we're going to close down the office early. I have someone really important coming in and they need total privacy. So I'm like, oh my God, wow, he's having like a star come in. This is going to be, I wonder who it is, because I'm at a really high sedity office. It's not, no, I'm in a good neighborhood. So I'm like, oh my God, I can't wait. Oh my God, it might be J-Lo or something. I can't wait to see who it is. So, I'm waiting and waiting, cleaning up everything. Can't wait. Got the office, ready to go. So excited to see my patient. And this scary witch lady walks in and I'm like, with like shrubby clothes on and, and I'm like, okay. I'm like, is this the patient? And they're like, yeah. And pull me to the side. They're like, and just make sure you're careful about what you say, because she doesn't like a lot of things and she doesn't like a lot of people. And I'm like, okay. Now I'm afraid of the lady. I bring her back. Okay, come on, you can come back with me. And she comes. I'm looking at her. I'm like, what the hell is her deal? Because she looks a hot mess. I'm talking about, whoa. I'm sitting here in shock that they just told me to close down everything because they got a special patient coming in. I thought I was going to see J-Lo. Not this lady. So I'm like, okay, all right, ma'am, you're going to have to sit down, you're going to get the doctor. I'm going to put this bib around you. She's like, what? You're not putting that around me. I'm like, it's the bib, ma'am. Yeah, I am. She's like, no. Matter of fact, what do you think you're going to do to me? I said, I'm not going to do anything. The doctor is going to look at you. She's like, no. What does he want to do to me? I'm like, he wants to look at you? Are you here because you're having a problem? She's like, no, I'm not having any problems. There's nothing wrong with me. Clearly, they're having the problem. I'm like, oh my God, what is wrong with this lady? I'm fucking scared. So I'm like, all right, well, no, you don't have to bid me. We're not doing anything. And matter of fact, go get the doctor right now. I'm like, okay. Go back. I'm like, Doc, I don't know. She doesn't want me to bib her. She doesn't want me to do anything. I can't take an x-ray. Like, what is she here for? He's like, I don't know. Her sister brought her. They said she's in pain. I'm helping her. He's like, Jack, you know she's a special patient. She's having a couple of issues. Her issue was she's a recovering drug addict with an attitude. People, I do have remorse for that population. But not when you come in the office and you acting all rude and stuff. Girl, bye. How you gonna be a recovering drug addict and acting like that? Excuse me? You're supposed to be humble and nice. What happened to that side? Because I definitely was not seeing it. So the doctor comes back. He's like, okay, all right. So, you're going to sit back so I can look at you? She said, no. He said, well, how am I supposed to determine what's wrong with you? She said, I don't know, but you're not looking at me and you're not touching me. He said, well, ma'am, I guess you're going to have to leave here because I can't do anything for you. If I can't look at you, how am I supposed to diagnose you? She said, I don't know, but somebody brought me here thinking I have a problem, and there ain't no problem with me. There's a problem with you. I'm like, Doc, we can't help her. She doesn't need help. I don't know why her sister brought her here. So we take her back to her sister, and her sister's like, you don't want to sit down? She said, no. Her sister said, well, how are they supposed to help you? Didn't you say you had a toothache? She said, I don't have a damn thing. A damn thing. And you better get me out of here now. I was just thinking, oh my goodness. I've never seen somebody so mad about quitting drugs. The fucked up thing was, I have to say this, people. when minorities come in to get seen, we don't get treated like that. We definitely do not get the red carpet rolled out for us. That was some shit. But hey, there's always a story in dental. Yo, that was the best day ever. I couldn't stop laughing. I hope you like my dental stories.